Today we're going to measure hip abduction, and before we get started, we're going to point out a few key elements that'll control for a good quality test here. So Alex here is lying on her side, and you can already see she has her underarm underneath her head. Okay, sometimes you'll see people that put their arm under their head like this, and that kind of changes rib position a little bit. So what I like to tell clients is, hey, put your hand underneath your ear like you're taking a nap on the pillow. And so great position there. Okay, if you had a pillow, if that was uncomfortable for someone, you could slide that pillow there. So head position is first. Next, we want to make sure ear, shoulder, and hip are in a straight line, okay? Because that's going to control for a lot of spine mechanics here, because we want to isolate really just the hip abduction position. The final component of this is when I come and support this leg underneath, right? We want to make sure this top hip doesn't roll back, because that's biasing us towards ER, which is going to skew our abduction measures. And we want to just make sure we kind of keep the hips stacked on one another. So I just like to take this hand. I'm not going to shove this hip forward, right? That's uncomfortable. I just want to make sure as I'm going into abduction, I'm not letting it roll back. The final component you just have to be mindful of is how much hip extension you're bringing them into. Most people don't have true hip extension getting all the way to 0. Very few of us actually do, and that's okay. So if I come all the way back to hip extension, okay, Alex pretty good here. Okay, you may say some people kind of come into lumbar lordosis here. That's okay. For the sake of this, we just want to back off a little bit to see where we're at for abduction, but also take note of that. You can measure how much relative hip extension they have before you start to see some sort of spine compensation. So for Alex here, I just like to roll the leg a little bit to make sure they feel relaxed. Okay, my hand's on top of their hip to control for hip position. Then I bring her back into as much hip extension before I see the spine start to move. Right about there, she's about 0. And then I'm going to lift up. And the very quick way to find out when they're at their end range is pay attention to the crinkles in their shirt. True hip abduction, they're just moving through the hip. But once you start to see those wrinkles in the shirt change, then that tells us the hip is actually hiking in order to get the leg up higher. So for Alex here, okay, I can get her probably, look at that, she's probably about 60 degrees. In order to do that, she's crinkling up in her shirt. So I'm going to back down. Okay, and I'm just going to keep going until I start to see some of those wrinkles move. And that's about right there. So she's about 30 degrees. And so this is how we measure relative versus absolute, both important, but giving us indication as when we want to layer a lot of our table tests for our exercise selection in the weight room within the whole performance therapy assessment. We really want to use all of our relative measures to understand what our starting conditions are, but then also measure any sort of adaptations that are occurring that will hopefully want to improve those range of motions based on the correct exercise. So again, just to recap here, make sure you have the setup correctly all the way from head to hip. Control how much ER moment is happening when you're lifting into abduction, and then use your eyes to pay attention to the shirt wrinkling, and then also just feel when you start to meet some resistance when you're lifting up into abduction. And this is how we can measure hip abduction as part of the performance therapy assessment.